I leave you to view this interview done by my counterpart, Marie Yambo, where the treatment of cancer has evolved over the years, aided by technological advancements. However, there remains skill gaps among medical doctors to ensure patients receive restorative treatment. Now, Marie had a chance to talk to two doctors, Dr. SIVARAM GANESAMONI and Dr. Gopinathan M from the MGM Cancer Center in India, who visited the country on a fact-finding mission on some of the gaps and opportunities to share in the latest expertise in cancer treatment. Dr. Sivaram began by explaining some of these gaps. Let's have a look. Enjoy the rest of the afternoon.
Everybody has equal access to healthcare, and the quality of access to healthcare also differs between countries, between community, between areas, widely. So how can we do better? So community participation is what I would say as the first way, creating a lot of awareness and take away the stigma and fear of cancer so that they reach out and ask for, voluntarily come forward and ask for health care and reaching the right doctor, creating a referral system in a healthy manner. Anything in an early stage is eminently curable. It is like putting out fire. Once the building is already burnt down, there is no point in trying to put out a fire. Most people who die of cancer, they don't just die of cancer, they die of their associated diseases. A 60-year-old lady with cancer is also likely to be a diabetic, hypertensive, with some cardiac ailment, some liver dysfunction, and chemotherapy and other treatment will further worsen that. Very simple. Let's take a small example of breast cancer. In the West, there are a lot of people who want to have breast enhancement, even as a pure cosmetic procedure. So that's been a lot of tweaking around going on in the West. So now employing the same principle, there are only two. There are two breasts. They both need to be symmetrical. So mastectomy, that is what it does. It takes away one breast. So creates a lot of asymmetry and imbalance. A lady treated at age 40, she survives till age 80. She's going to feel that loss for the rest of her life. So this is what we want to avoid. The breast is a fatty organ. So there is a lot of fat available in the body, which you can replace. Right. If you have to remove it in toto, you can still bring in tissue from the abdomen, free tissue transfer, and put it back so that the shape, size, and even the feel and sensation are all normal. And the scars, conventionally, earlier we used to put it vertically on a visible area. Now we just say, keep it out of sight. So the word was actually coined way back when penicillin was invented. That was called chemotherapy then, right? Malarial treatment, that is chemotherapy. Anything that you use a chemical is chemotherapy. So let's take away the fear and stigma of the word. Insulin resistance comes due to increased carbohydrate in diet, and sugars in any form are going to be increasing your cancer risk. Yes. So we need to have them in moderation. So how carbohydrates can trigger cancer is if you are taking more carbohydrate load, your body's insulin levels are going to be high, and insulin resistance is going to be there. Insulin is something that causes growth factor. It's a positive growth factor, and a lot of cancers are driven by this insulin-like stimulus. And furthermore, it's very interesting to know that cancer cells can survive only on glucose. They cannot survive on fats. Whereas the human body is like a hybrid mechanism. It can survive on fat or it can survive on glucose also. No other mammalian species drinks milk from another species, not from another mother even. And no mammal takes milk as an adult after growing teeth. So man violates these fundamental principles. And milk has a lot of, again, peptides and proteins in them. So not just cancer, a lot of this autoimmune disorders could be, and some GI diseases could be milk-based. So moving to a plant-based milk improves the health for many people. This is again not been actually proven or implicated, but it could potentially be a reason. Now, any amount of meat, more than 150 grams per week, say give an allowance and give it to 200 grams per week, more than that consumption is going to be increasing the cancer risk. We know that one of the prime reasons for having cancer, apart from tobacco and alcohol and other infective process, is lack of a good physical routine. Adults need to have 300 minutes of moderate intensity aerobic activity per week. Be open to the possibility of screening, because the single most positive way that you have to in this fight against cancer is to screen yourself against possible diseases. When I speak about Kenya, we also see a lot of patients with elevated family history of prostate cancer. They could be starting screening with a simple blood test, serum PSA, annually from age 55. And women should have cervical cancer vaccine if possible as before being sexually active, or if not, they should be on a regular pap smear and DNA-based screening tests are available annually. Those can be done. And colorectal cancer, again, limiting the amount of red meat. Never fear. So if you fear kills away kills you more than cancer. So anybody confused, anybody in fear, distress is less likely to make right decisions about treatment. Seek and learn about the disease in hand and participate in the treatment decision making at a very early stage. Just because you got cancer, don't stop working out. If you are an outdoor person, do continue all your routine activities. Don't become a patient. Don't be bedbound, because that is going to further decrease your prospects of getting better. And smile, because all smiles, I've seen in general, when you look at, often we want to see the patient. We don't just assess the health, but also the emotional or the mental health, which I think is very important, very vital. We talk about 3 healths which need to be optimized: the physical health, the mental health, and also the economic health. That is where the family comes in. Yeah. You should not be strained for resources for doing the right things.
I'm Dr. Gopinathan, consultant hematologist, practicing at MGM Healthcare and Cancer Institute, Chennai. I specialize in treatment of blood disorders, blood cancers, and bone marrow transplants. So mainly if we talk about cancerous problems, they all come from your white blood cells. Because it is interesting to note that these white blood cells have something called nucleus. And nucleus contains your genetic material, that is DNA, and which is prone to error and mutation. So all kind of blood cancers, most of the blood cancers occur from your white blood cells. So we have various types, something called as acute leukemias, which are called as ALL and AML, and we have lymphomas coming next to it, and then the last comes your multiple myeloma. Apart from that, there are various other rare type of cancers like LCH and all this, okay, but majority of the cancers are these. Aggressive blood cancers are dangerous, of which topmost which comes in children are acute lymphoblastic leukemia, and second is acute myeloid leukemia. So they are most aggressive ones. And next comes your high-grade lymphomas, which are like your lymphoblastic lymphomas, Burkitt's lymphomas, DLBCL. So they are all high-grade lymphomas. Once upon a time, if a disease relapses, it is a death sentence for the patient. But now, for those patients who have even relapsed, we do something called as salvage chemotherapy. That means we try to get that disease into control and then perform a bone marrow transplant. So that is the current advancement. And moving again away from stem cell transplant, we have something called as CAR T cell therapy and gene therapy. So CAR T cell is nothing but your own body's immune cells. They are your T cells. Okay, they are collected and they are processed and they are made to fight against your own cancer cells. So basically in our body we have cancer cells and we have something called as immune cells. Immune cells are your T lymphocytes. Now what happens when a cancer forms, blood cancer forms, the cancer cell cheats the immune cell. It tries to escape from it, like how a child gets away from the mother and goes to hide inside your room. The same way the cancer cells cheat the T lymphocytes and then escape and hide. Now what we do is we take out those T cells and artificially engineer them to make it more vigorous and active against the cancer cell. So the same body's, the same person's cell can be made tricky to attack the cancer cell. So in that way, you don't need to depend upon a different donor. You don't need, a high-dose chemotherapy and all that, like we typically perform for stem cell transplant. And the same T cell can be put into the same patient. Transplant is nothing but your own stem cells in case of autologous transplant, or a different person's stem cell in allogenic transplant. And then we do a chemotherapy, high-dose chemotherapy, in order to fully destroy your disease or your bone marrow cells, native bone marrow cells. And then we put the stem cells in to get the proper function what we need from it. The success rates comes with the type of cancers we perform. So if you're performing bone marrow transplant for a good biology AML, that is a good risk of AML or intermediate risk of AML, then the success rates are really good. But whereas when you're performing it for a high risk AML, then the success rate we keep it around 30%. Whereas if you're really performing it for a good biology or with an intermediate risk blood cancer, the success rates are as high as 80%. And autologous stem cell transplants these days are having even more higher success rates, close to 90%. And those bone marrow transplants performed for non-cancerous blood disorders like thalassemia, sickle cell anemias. Having said, if you're performing it at an early stage, the success rates are nearly close to 90%. So this is one catch here. Per se, with regards to other cancers like breast cancer, stomach cancer, colon cancer, diet doesn't play a major role in blood cancer. It is only to do with your genetics. So that is a specialty about blood cancer. So it means somebody's DNA has got damaged. So now we try to repair it either by simple medicines, which is chemotherapy or targeted therapy, or in case if the genetic damage is going out of hand, that means you have to replace that person's blood with a different donor's blood. So people will start feeling extremely tired, weak, they don't feel like working. Children, they don't feel like playing. They are not interested in their surroundings. So that is gone. Second, you have WBCs. As I said, WBCs fight against infections. So they are easily prone to infections. So they come with long-standing fevers. Suppose coughing or sneezing near a blood cancer patient will also make them vulnerable to infections. And third is they lose platelets. So when they don't have platelets, automatically they start bleeding. There is no need to worry about blood cancer. Keep yourselves well checked. Perform your annual master health check on time. And consult a hematologist in case if you find some variations immediately.